What is the effect of optimism on physical health? Optimism is the tendency to expect a positive outcome to future events that occur, and physical health is a fuzzy, all-encompassing concept which can be encapsulated through multiple factors as seen below. Optimism can be broken up into different types, being dispositional optimism, unrealistic optimism, and an optimistic explanatory style. Explanatory styles came from Abramson, Seligman, and Teasdale, reformulating the model of learned helplessness to propose that individuals have habitual tendencies of explaining stresses in their life called attribution styles. These styles, being optimistic or pessimistic, were dictated by three dimensions, being stability, internality, and controllability. Optimists generally exude external, unstable, and controllable attributions, whereas pessimists show internal, stable, and uncontrollable attributions, like shown in the example below between James and Mike after the school spelling competition. Evidence suggests that having an optimistic outlook, either dispositional or explanatory style, has an influence on one's physical health. This can be seen through lower levels of cardiovascular disease biomarkers in optimists. These include interleukin-6, C-reactive proteins, fibrinogen, and homocysteine levels. This was reinforced by a meta-analysis showing a dose-response association between optimists and decreased cardiovascular and all-cause mortality events. The specific pathways in which optimism is able to impact on physical health can be seen through influences on coping strategies and adherence to health behaviours. Optimism can help individuals cope to stress, allowing longer persistence through stressful times. Ness and Segerstrom also found that optimistic people tend to know and change their coping strategies depending on the controllable or uncontrollable stresses faced to better adjust to the situation at hand. Hence, optimists tend to have lower degrees of experienced helplessness, whilst pessimists have higher, impacting on their coping behaviours or lack thereof. This was illustrated within a Dykema and colleagues study, showing pessimists were more likely to neglect basic coping and health behaviours like self-health care, seeing them as futile in offsetting illness. These neglected self-health care behaviours included proper sleep, nutrition, and exercise, which are all known factors to improve physical health and functioning. Taken together, it appears that optimism's impact on physical health is mediated through an individual's coping behaviour and strategy. However, optimism can also greatly affect an individual's adherence to treatments and health maintenance behaviours, such as proper sleep, exercise, and nutrition, which in turn can affect physical health. For further information on this topic, follow the link below to the Wikiversity book chapter.